Let's get into something now, which is very, very controversial. Florida's Surgeon General, Dr. Joseph Ladapo, said a few days ago this.
The Florida Department of Health, in partnership with the governor, is going to be working to end all vaccine mandates in Florida law. Every last one of them. Every last one of them is wrong and drips with disdain and slavery.
Now, it's interesting that it's the Surgeon General and not the governor running with this idea. I think that that's a political hedge. But I want to bring in the Surgeon General of Florida and have the conversation, Dr. Ladapo. Doctor, thank you for joining us. Appreciate it.
Yeah, thank you.
So, Doc, you're not a politician, but let me hit you with the main optic of resistance to your policy recommendation, which would be the President of the United States, who said as gently as he could, which I guess is a nod that he must like you, that be careful. Be careful about saying that certain people don't have to take vaccines. They work. They work well. They make a difference. He does not seem in favor of what you're discussing. What's your reaction?
I didn't know. That's the first time I'd heard that the president said that. But, you know, I'm not trying to make any recommendations for President Trump. I'm simply, as I've been doing since my tenure here and years before then, just saying what I believe is right. So that's, you know, that's what I have to say.
All right, I got you. But let's dig into this a little bit, okay? Now, obviously, I am no clinician. I respect your pedigree very well. I don't know how you get better than double Harvard. But it does seem that the weight of your community is at odds with you, that not all vaccines are the same, and that a reason we have had advances or reductions, if you want to look at it conversely, that illnesses have disappeared in our society is in part because of vaccination. And if people don't have to take them, then they won't take them, and then we won't be as healthy a society. Your response?
Yeah, I mean, I understand that argument, and you know, I think it's certainly a reasonable argument, a reasonable position to have. I would say that the reason that I made this statement, it wasn't, you may, if you listen to the speech, I didn't say anything about any vaccines being effective or ineffective, because it's not about that. You know, it's probably actually, you know, during this job, I mostly had scientific discussions, but this one is actually more political because it is a philosophical discussion. And the philosophical debate is about whether parents' rights should prevail when it comes to the health of their children, or whether the government's rights or the government's interests, however it perceives those interests should prevail. And I personally have zero doubt that the correct position, particularly for society that values freedom and wants to preserve freedom, is that parents must prevail. Parents must prevail.
But why should, look, I'm a parent. I have 3 kids, right? And we made our own vaccination choices. But because there was discretion given to us in that regard, but there were consequences with the discretion. Why should the parent, even though I am one, right? So I like what you're saying, Doc, but why? Why should I win? Why shouldn't science win? Why shouldn't people like you win, who we empower to make recommendations based off science? And they say, no, I get that you don't like vaccines, but you're not as smart as Ladapo. And he says that these vaccines work, and we want within our kid community to not see measles or mumps or rubella or polio. And we don't want other kids to be more subject to contagion because you're not vaccinated. So you don't get to decide for everybody else, just for your own kid.
I mean, there was a lot there that you shared, Mr. Cuomo. I would say people bring up the scientific part, and that's a good discussion to have. Effectiveness, safety, adverse events, etc. And by the way, there are issues there too, because one of the tenets of medical treatment is informed consent. And by the way, you can't obtain informed consent if you are coercing people. And when you have a mandate and there are negative consequences to not complying, well, you can't obtain informed consent, which means you can't provide ethical care. But putting that aside, this isn't actually a scientific debate. This is about whether the parents' interests should prevail over the sovereignty and the autonomy of their bodies and their children's bodies, or whether the government should prevail. It's that simple. I mean,
I think that's demonizing government,
could
Doc.
be perfect.
I think that's
but
demonizing
still.
government. I think it's demonizing government.
I
I do.
don't
I think it's a piece of sophistry. I really do,
Okay.
Doc, and I'll tell you why. I'm all in favor.
Yeah.
Again, I want to say what's right for my kid. But it's a piece of sophistry, Doc, because that's not what it's about. My right to control myself, my free will, ends at your nose, right? We all know this analogy, right? Your ability to use your fist ends where my nose begins, Doc. You know, you don't get to infringe on my rights by exercising your own. And it seems like here you're making it okay by demonizing the state. You know, the less the state has control over us, the better.
Yeah. Actually, that's actually another debate, but I'm not trying to open that area. It's interesting what you just said, Mr. Cuomo, because you just talked about one party imposing on the rights of the other party, and if you listen to what you're saying, you're basically saying that this is a situation where the government gets to impose on the individual's rights and preferences, and people can believe that. I personally believe that that's wrong, that the more freedom that we give people, particularly over their bodies. We're not talking about seatbelts here. We're not talking about, other things that we do in society. You got to pay for stuff when you get your gas. You don't get to get your gas and walk away. We're not talking about that. We're talking about your body. And if you don't have control over that in terms of what you put in your body, I mean, what's the whole point? Why are we here?
I got it.
So I hear what you're saying, Mr. Cuomo, but literally your words are supporting the actual thing that you're saying you're against.
Well, but no, doctor, it's because of how you're using them, right? And look, here's why it can't just be that I love to be controlled, right? You can Google me for 2 seconds and know that's not the case. But it's that, okay. Doctor, it's the people who have pedigrees similar to yours, all right? Again, I'm exercising deference here because, you have a hell of a pedigree and a history, and you're Surgeon General for a reason. And I'm not questioning you on that level. That would be cheap. But other people similarly situated to you, almost in the entirety, don't agree. Even religious leaders like the Pope, Franklin Graham, Rick Warren, all came out on this issue of all things to say, hey, there's a moral obligation. There's a Samaritan simile here where people have to think about others, not just themselves. Why is the medical community and even some big religious leaders saying, whoa, go slow when it comes to ignoring all vaccines?
I mean, you could ask them. I mean, I think that one of the things is that people, my sense is that people have grown to normalize it. The notion that, when it comes to this particular thing, like, you have a doctor, you go see your doctor, and, say, your blood pressure's high, your cholesterol's high, doctor prescribes you something, and, and you choose whether or not to take it. With vaccines, there's the existence of mandates has sort of normalized the notion that, well, you have control over your body in terms of your personal medical decisions, except for this area. And, it's quite widely held. Frankly, I held that belief myself. And over the last few years, and certainly like many people, including yourself, from what I've heard you say from during COVID, my eyes have been open. I've reevaluated many things. And in this particular area, I hear you. Many people disagree. I could live on this earth for 1,000 years. I will never, for once, believe that it's okay for a government to make the choice over what you put in your body and for that to be more important than your personal preference about what you put in your body. It will never change. Same thing for your kids. I mean, it's a very simple truth, in my opinion.
It's a simple truth, but it doesn't mean that it's a better choice necessarily. That's all I'm saying. I mean, look, these things, right? So again, with due respect, I know people always use that as a throwaway statement. It means I'm about to insult you. I'm not about to insult you. I'm just saying that you know all the numbers. You do know all the numbers. You know, whether it's the CDC or Lancet, they say that the reason that we have gotten to a better place is because of our vaccination rate in terms of herd immunity with a lot of things. And that's why I'm bringing this up. Is this best practices for a perverse sense of people's freedom and control and animus towards the state, or is it the best practice for medicine? That's why I ask, because of the pushback from the medical community. How do you reconcile the rejection of your colleagues of your suggestion?
Yeah, I think I would say two things. You know, it in a way, right? It's unfortunate that people don't have enough, you know, because we have this conversation and people go straight to, oh, you know, all of these diseases are going to come back. Well, why would they come back? I mean, why do you feel that providing parents with information about the benefits and risks of different vaccines isn't sufficient for them to make a decision? Or do you not trust the decision that they'd make? So every step of that, there are problems. And I don't feel that way. I think that parents, you know, inherently have the best interests for their of their children in mind. They know their children best.
Of course.
I think it's absolutely better to have it that way. And then the second thing I would say is that, you know, and Mr. Cuomo, you are familiar with this, having witnessed it over the last few years. The whole sky is falling thing is not a new strategy in public health in terms of trying to either prevent policies from being implemented that they don't like, or to allow people to kind of abandon silly things like wearing 4 masks, as Dr. Fauci was encouraging people to. So there are other countries that do not have vaccine mandates for children to attend school. Sweden is an example of that.
Right.
You know, the sky's not falling there. I believe the United Kingdom is another example of that. Denmark maybe also. So people were really, really, you know, excited about this, both in the positive and the negative. But it's ultimately the right position. Parental rights absolutely matter. And my Lord, if they don't matter for control of your body or your child's body, when the heck do they matter? So it's a position that I'm very comfortable with.
I get it, but, you know, first of all, look, you know, sky is falling. I am not discussing with you the metaphor that you used about what you think vaccines are like in terms of like them being like slavery, because I just don't know where that takes us as a productive conversation.
No, not vaccines.
Right, no,
I'm sorry for any misunderstanding there. Not vaccines.
I totally get it, Doctor.
Mandates, particularly mandates over your body.
I totally get it. But
over your body.
First of all, the COVID,
over what you put in your body.
To what you said. The key to what you said, though, is informed consent, right? Because the reason I come to you is because I don't know as well as you do. You're the doctor. And I think the president had an unusually good idea, which was, let's have all the data again debated by people of your pedigree, real clinicians, real people who know various ideas, and let's have that out loud about what we know about the COVID vaccine or therapeutic, depending on how you see it, and the other ones that are mandated. What do we know about the efficacy, about the safety, and about the difference they've made in our society? Let's have the debate instead of saying, you always know best. People don't always know best. That's why we have experts in the first place. That's why we have science. But I appreciate you making the case here, Doc. You are always welcome to do so, because this conversation is not going to end anytime soon.
Hey, thanks for having me on.
You are welcome. Florida Surgeon General is a big gig, and your voice is going to be heard. And you're welcome here to talk about when it's accepted and not accepted.
Okay. Thanks very much. Good talking with you.
All right, take care. Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.